Hi, everyone, and welcome to our second annual private practice conference. I'm Dr. Donna Coriel. I'm the founder of SoMeDocs, and I'm very excited for all of the shenanigans that we have in store for you, the speakers that are lined up, the panels that we have going. We have two really great panels with um, panelists in line and really interesting topics to speak about. So, good evening to those of you that are here. Hopefully, we will figure out the Zoom link issue that people are having. Welcome to the Private Practice Conference. I'm so excited that you're here, whether you're tuning in from your cozy home office, a corner of your clinic between appointments, or even secretly on mute while you're eating dinner in your kitchen. And don't worry, I won't tell if you are. We're about to spend 3 days together learning, connecting, and maybe even laughing a little bit along the way. Now, I know conferences can sometimes feel like you're drinking from a fire hose. Information's coming at you fast and furiously, to mention a little movie mention there. And before you know it, your notes look like a mixture of hieroglyphics and grocery lists. So our time together is going to be different. We're going to learn, yes, but we're also going to take moments to breathe, to reflect, and to connect with each other. This is a professional event, but I want it to feel human too. We are all here because we're committed not just to our practices, but to the people that we serve. And doing this works in a way that feels sustainable and hopefully even enjoyable. Let me take a second to just check out the Zoom and see, okay, everything's fine there. Okay, so a little bit about private practice. Private practice can definitely be a lonely business. You're the CEO, you're the HR department, the marketing team, the billing specialist, the provider of the actual services. Oh, yeah. And if you've ever found yourself Googling things like, how do I fire myself from answering the phones, then you're in the right place. So, over the next 3 days, we're going to dive into practical strategies for running thriving practices, but we'll also talk about the intangibles, things like mindset, boundaries, community, the things that keep us from burning out when the to do list is longer than a CVS receipt. So, format wise, I'm going to soon be going through exactly how we work this conference and the different spaces that you can click into online to take part. But how it works is that we'll have structured learning sessions, and the real magic is going to happen in the spaces in between, right? Obviously, the learning lessons are very important and very and the important part of this conference, but in between is where we are going to really connect. So that's inside of our Facebook group where we're going to network, share takeaways, hopefully cheer each other on. Think of it as the conference hallway track, the conversations that you'd normally have over coffee between sessions, but this time without the overpriced muffins. And that's really the crux of why these kind of online conferences really work. Then at the end of our time together, we're going to gather for a live virtual networking event. That's on Saturday at 5 p.m. Eastern Standard Time. Those are always super special. And we're going to have the speakers joining us and attendees from all of you from private practice and also any of the SoMeDocs community members that want to join. And that's where we'll be putting names to faces. We're going to swap stories. We're going to leave with connections that I'm hoping will last beyond these 3 days. So now I want to address the elephant in the Zoom room. And yes, this is virtual, which means we'll be experiencing all the classic online quirks. The dogs barking, the kids wandering into our backgrounds, maybe someone forgetting that they're on mute when they're going to deliver their actual lecture, hopefully not. But it's all welcome here. So if you need to stand up and stretch, do it. If you need to eat a snack on camera, we applaud you. And if you forget to mute And we all get to hear you singing to your cat, or if you've seen a reel that I made recently, stretching like a complete weirdo. Well, congratulations, you've just made networking a lot easier. So, my invitation to you is to show up with curiosity, to ask questions, to jump into discussions, to save and share resources that resonate. The more you engage, the more we're all going to get out of this. So please feel free to use the chat the uh, in the Zoom session. Networking can feel intimidating, especially in healthcare, but we're all in the same boat. So remember that. Everyone here knows what it's like to juggle clients, admin work, and occasional panic, right? Over whatever it is that's happening, whether it's quarterly taxes or an angry patient or whatever it is. So let's lean into that common ground and make these 3 days a chance to really support one another. So I am going to go over exactly how this works. I see that there's a whole bunch of people here waiting. I'm going to go over how this works. And again, I know that there were some issues with the Zoom link, but hopefully we will fix that. But before I go over how everything works, I want to announce ahead of the conference the giveaway that we're going to be doing over the course of these 3 days. And it's really exciting. One of you is going to get a unisex t-shirt of your choice from that specially made private practice collection that I shared. I'd love for one of you to win it. It's going to be picked at random. So anybody that shares our conference on social media and tags us at SoMeDocs so that we see it. You can share about a favorite lecture. You could share about any pearls that you're learning, anything that works on your account. You can share about just being a part of the event in general, but just sharing qualifies you to win. We did this in our last conference, the Obesity Medicine Conference, and a private practice owner actually won, and she just got her t-shirt and she posted. So I put it in our Instagram story. So that's really fun. She's wearing it outside. She loves it. She says it's great. So I'm really excited to give another piece of swag out. So you can pick either a t-shirt of your choice or the cap. So we have a like a Chief Everything Officer cap as well. And we're going to announce the winner Saturday the 27th right after lunch. So if you're here watching live and you're not doing this VIP, you could take part and hopefully you can win. Okay. I am now going to share my screen and I am going to, uh, let's see, Zoom and share. Okay, so I'm going to share my screen and I'm going to take you through, sorry about that, let me just get it going. I'm going to take you through the different segments of this conference so that it's easy and that you don't have questions. But if you do, you can ask them as well. So there's the landing page, and that's on our website. That's on doctorsonsocialmedia.com, right? You can go to hover over lectures on the menu and then pick conferences and pick the first one you see there, which is our private practice conference. And here on this landing page, you can either click on the buttons that just take you straight to what you need, or you could scroll down and you can, watch our promo. You could purchase a ticket. You could upgrade to VIP access if you've missed anything and you feel like you really want to catch it. You can take a look at our speakers. You could actually even open up any of the pages, any of the speakers' pages, and read more about the lecture, meet the lecturer, hear them talking, and even go into their profiles if they have one. Most of them do, and learn more about them, send them an inquiry, etc. But you also have the agenda. So this is where everything's going to be written out. We're right now doing the introduction. We've got Dr. Daniel Paul next, and then a whole slew of speakers coming the next 2 days that you can look over. We've got our sponsor, of course. I do want to give a shout out to our sponsor during the intro. So SuperDoc Tech. It's a physician-founded tech and growth platform built by two docs. So that's really cool. And they're going to be joining us actually and giving a lecture on Saturday morning. The SEC, really quickly, the SEC is stands for the SoMeDocs coaching cohort. It's made of coaches and consultants. And these are network level members that join us and get all of the other perks, but amongst them is being a part of our conferences and being able to really help us to take this to the next level and get everyone talking and excited. And as you could see already, our Facebook group is alight with discussion, and I hope that more of you join in on that. And they will also be present during the networking session to host the breakout rooms. So that's the SEC. We have swag. We have 4 different swag that was specially made for this conference. So things like a t-shirt that says patients before paperwork always. And we have private practice CEO, chief everything officer. And we've got 2 others that aren't showing here. And we have a hashtag SoMeDocsPP, which hopefully unites us on social media. If any of you want to post or want to qualify for that giveaway, you could use the hashtag, but definitely tag us. We're at SoMeDocs. And you could look at all kinds of different things in our landing page right here. Now, the other thing that's on our website is the actual conference, which is going to convert into a course, meaning all of the speakers are delivering lectures that are going to be recorded, and that recorded footage is going to be available to any one of you that has VIP access. So if you have not purchased a VIP ticket and you can't catch everything live, that is how you're going to be watching it. We have a lot of VIP ticket holders, so thank you for that. That means that you're watching this later, and that's okay. And you will be watching it right here where you purchased your access. I will be sharing that direct link later in the group and also by email. Please do open up all of our emails, especially in these 3 live days, the days of the live conference, since all of the links and everything you need are going to be in there. So those 2 things are directly on doctorsonsocialmedia.com. You can find all of our conferences that we've already held now there as evergreen courses. Again, you hover over lectures and you go to conferences, and you will find both the conferences that are coming up that you could still sign up for and past events. So this is where the footage that is available that already has happened live is now evergreen courses. The other space that's really important is our interactive space, and this takes place while the conference is live, especially. Nowadays, we do keep these groups open so that we can talk about things and we can network outside of the actual live conference. So that's really an exciting change. You will see in this Facebook group that there's a featured section. That section's very important. If you click on it, you will see all of the important posts. So for example, the agenda, right? You can just get the schedule right there. And you don't have to look into the landing page. You'll see important links, the Google calendars here, all the details of the speakers. You could upgrade your ticket. You could see the doctor directory. So that's an important link where you can really link up with anybody that is here that's a member. We have many, many, many members that are now part of SoMeDocs. I'm so appreciative of that. In order to see this group, you can press these 3 buttons. So this is the menu, right? Featured is what I just showed you. Those are the posts that are pinned to the top. Discussion is where you can see everyone's posts. So when you scroll down, you could see everything that's been shared from the introductions, which I welcome you to do. Please introduce yourself, tell us who you are, but also to other facilitating posts. Like I just posted, if everybody wants to share their websites or their LinkedIn, let's get connected. So those kinds of posts are in the discussion. Now, to the right of this menu are these 3 dots. When you open up those 3 dots by clicking in them, you will see mine isn't showing up because I have more than 10 groups. But you will see that there's an option to pin group. When you click it, it will pin it in the front of your Facebook so that you can get there very quickly. The other way to do it is just to go to the front of Facebook and write private practice, and it should show up. I don't know why it's not showing up momentarily. There it is right here on the bottom, but Facebook's kind of quirky like that. The other thing that you can do here is you can manage notifications. And when you manage notifications, you can choose all posts, which is hopefully, again, this is Facebook, so you can never count on it, but hopefully going to show you all of the posts in this group. And that's especially important in the next 3 days when we are going live. So all posts and then save. And then that's going to hopefully show you notifications from this group specifically. I've actually created a screen share video of how to do that in the past, and I always share it to every conference and I pin it to the top. I will do that this time around too. When I'm finished here, I will go in here and I'll find that video and pin it to the top in case any of you need, another explanation to that. Otherwise, this is, like I mentioned before, literally like the conference hallway where you can interact with everyone else that's attending this. You can network, you can meet others. The purpose of this really is to not just learn from our speakers, but to also network and meet others and come up with new resources that are out there that maybe you didn't know about, that's going to make your life easier and the building of your practice easier. I'm we've had our conference. Oh, sorry, let me just open this up. We've had our schedule set for quite some time, but as always happens, there were a few changes last minute. And I'm happy to also say that the two physicians that are sponsors in the conference are also going to give a lecture about CRM. So if you don't know about that, they are going to elucidate what a CRM is and how it's going to help run our practices better. And of course, there's the panel discussions. Dr. Aguila is going to talk about starting and running a direct care practice. He's got 3 panelists that have joined. There may actually be a 4th that's coming on as well. And then I am going to moderate a discussion on private practice owners with some more general questions that we can ask. So that's all again on the agenda. Yes, there are educational credits that are associated with this conference, whether you watch live or you're watching this after the fact through a VIP ticket purchase on the site. We work with CMify and Learner Plus. They are a physician-founded company that is really cool, for lack of a better term. I love when companies are innovative. They really make earning CMEs and earning educational credits in general easy. And they do it through reflectional credits. So that puts the onus on the actual healthcare professional who's watching and who's learning to jot down what they're learning from watching whatever lecture that they're watching and then earn those credits. So it works really nicely, and it's completely through them. We don't get involved. It's $50 for the year, which I think is very reasonable. And it works for any of our conferences. So if you decide that you want to purchase the obesity medicine conference access from last month, you can certainly use the CME credits through CMify for that. If you decide to come to the entrepreneurship conference next month, or the finance and investing in real estate conference the month after, or the AI and healthcare conference, you can use the CME credits through CMify for that year, for the $50 that has bought you. So that's right on our site, purchase here, right there, and it takes you directly to them. If you are watching this live and are contemplating purchasing a VIP ticket, you absolutely should, and you should not wait. Our price went up to $199 today, the first day, and will go up again at the end of our live event to $249, which is our final price. So if you purchase now, you could still get it at a discount, which I highly recommend. Um, so that's it. I'm here with whoever's here live. If you have any questions, you can ask them in the chat box. I might have forgotten something. I always forget something, and then I say, oh my gosh, whenever I'm done, and then it's too late because I stopped the recording. So if anybody is here and can think of anything that I have forgotten, please write it in the chat. I will say, as I'm waiting for anybody to write things that are still not clear, I will say that the chat box is here for use. This is very much like an in-person conference. I build this exactly like in-person conferences because my goal is to lower the costs of us both interacting and learning from one another, right? Conferences are so expensive to go to these days, especially medical ones, and there's no reason for them to be expensive. So I'm trying to really lower that cost and also allow us to learn from our homes so that we don't have to leave our children and our families and our pets and our loved ones behind for a long period. And we could do everything that we can do in an in-person conference, we could do at a virtual conference. So, in an in-person conference, when the speaker talks, obviously it's rude to talk in the audience, but that's the difference between that and an online conference. When you talk while the speaker talks, it's absolutely okay, and it's actually encouraged. So you do that in the chat box. So just click on your chat and use it to talk about whatever it is that you want to talk about with others. You can ask a question, you can ask your questions. So I will be looking through, and if there are questions, I will ask it when the speaker finishes their talk at the end during the Q&A section. So ask your questions there. You can write notes, you can share pearls that the speaker is lecturing on with the rest of us. You can answer. Sometimes I'll ask an icebreaker at the beginning, and you can keep it going while the speaker is talking. But if the chat box is distracting for you, you can turn it off. So what you could do is literally just click chat in the bottom menu of Zoom, and it'll make it go away. So if you're someone that cannot focus on the speaker, if the chat's going and people are writing in it, please don't let that distract you. Please don't ask people to stop using the chat box because we like it here. Please just click on the chat and that will go away and you will just be looking at the speaker. Okay? Otherwise, I see that there's no other questions that I haven't covered. In that case, we are going to be hearing from Dr. Daniel Paul in just 5 minutes. I'm going to give those people that are here a 5-minute break by turning off the recording and my camera and looking at all of the questions of the people that couldn't make it and can't find the Zoom link, etc. So without further ado, I hope that you enjoy our second annual private practice conference.